Hello everyone and welcome to this flu vaccinations and people with learning disabilities webinar. Just a few quick ground rules. I will introduce you to the presenters in a moment. Please everyone stay on mute throughout the webinar. If you're watching this webinar as a recording or you're with us live today, you can email questions to ldt@phe.gov.uk. We're more than happy to respond to your questions even after today. I will be asking the presenters some questions at the end of the session if you'd like to stay on for about 10-15 minute question and answer session. And just a final point, the slides are presented as an overview, not an in-depth explanation. There are links to various places you can go to find more information. So with us today we have John Tervanes, who's going to tell us why there's a refocused effort on increasing the uptake of flu vaccination from an NHS England perspective for people with learning disabilities. Giles Glover from Public Health England, who will give an overview of currently available data about uptake. Anna Marriott, who will talk us through some ways that adjustments can be made by services to help people with learning disabilities get the flu vaccination. And I will be concluding with a prompt for us all to think about actions that we can take to improve uptake. So I'm going to hand you over now to John Tervanes.
Thank you very much, Donna. My name's John Tervanes. I'm Head of Learning Disability and Mental Health Nursing at NHS England. Me and my team lead on work around improving health access for people with a learning disability. I'm sure everyone on this call knows why the flu immunisation programme is important for people with a learning disability. But to start us off, I think it's important to look back at some of the reports that demonstrate why. On this slide, you'll see that the SIPOLD report, the Confidential Inquiry into Learning Disability Premature Mortality Deaths, highlighted that respiratory illness is a key factor in premature mortality. And this continues to be recognised in the latest learning from our premature mortality work. In the most recent LEADER report, though it was a small sample size of circa 100 cases, it still reinforces its importance. Another recent study in London focused on this matter in more detail, and it showed that respiratory system disease admissions in adults with a learning disability are more frequent, of longer duration, and have a higher likelihood of recurring. Therefore, anything we can do to help address causes of respiratory diseases should be prioritised. Flu immunisation is, of course, an effective intervention in this area. Therefore, promoting flu immunisation is a key action for us all as health and social care staff. This work fits in with other health improvement work for people with a learning disability, such as annual health checks, GP registers, and health action plans to holistically address the health needs of this vulnerable group of people. Thank you. And I'll now hand over to my colleagues in Public Health England who will be able to talk you through this subject in more detail. Over to you, Donna.
Thanks very much. So handing over to Giles Glover.
Hello, can you hear me?
We can, yeah.
Good, okay. Influenza immunisation has been available for many years for older people and people with certain conditions that make them particularly vulnerable. But it wasn't until 2013-14 that it was routinely offered to people with learning disabilities, unless they'd got a long-term neurological condition or other condition specifically covered. Recent work by the Observatory has underlined the figures that the Confidential Inquiry produced. We found that about 5% of people generally who don't have a learning disability die of pneumonia, but about 8.5% of people with a learning disability do. And they die at much younger ages. So when we allow for their younger age profile, there are more than 7 times the number of pneumonia deaths that would be in people with a learning disability than would be expected from general death rates. In addition to premature deaths, as John pointed out, influenza pneumonia is also an important major cause of unnecessary hospitalisation. People with learning disability have more than 5 times the number of emergency hospitalisations for potentially avoidable causes generally as people without, and they use nearly 5 times the number of inpatient bed days for these admissions. Now 17% of those admissions and 28% of those bed days are for influenza pneumonia. That's the single largest cause of the increased amount of bed use by people with a learning disability. So the 2014-15 flu season was the first time people with learning disabilities were eligible for free flu jabs. and from their GP, and GPs were able to get payments for doing them at that point. In the first few years, there was a lot of confusion about this. People with learning disabilities and their carer were advised to go and ask their GPs for flu immunisations, and a lot of them got told that they weren't eligible. And this has been a repeated story, despite a number of prompts. I think the source of this is that although GPs can decide anyone with a learning disability is eligible and can record that, the precise rules say that this is at the GP's discretion, and as a result, the computer systems GPs use don't routinely call people just because they've got a learning disability. The GP has to record that they've got a learning disability and they should get flu jabs, and the obvious point to do that at is the annual health check. Can we go on to the next slide, please? We can see how much progress has happened in the first 3 years of the learning disability of the programme from the Learning Disabilities Health and Care data set. This is a special extract we get from GP practice information systems comparing people with and without learning disabilities. So this gives wonderfully detailed data about rates of illness and obesity and health checks and some types of treatments. The only drawback with the system is that we can't get information from general practices that use System 1 computer systems. So that means we've only got about 56% of the country covered. Now, I've given you some links to the full details of this data in the slide, and you can click on that. And you'll also see on that NHS Digital, one of the things that the system covers is flu jabs. I've given you a link to the details, and I've also given you a link to the NHS Digital interactive browser, so you can look at details for individual local areas. The issue about coverage is important because it's important when you're looking for a local area to check how good the coverage is. So let's just give you a couple of examples of that. Can we have the next slide, please? So this is what the NHS Digital browser looks like, and what I've done here is shown the results for flu immunisations for Surrey Heath CCG, which I have to tell you is doing comparatively well. There's not many people with as good a coverage as 56.3%. Remember what I said, it's important to look and see how much coverage of the system they've got. So 51% of people in Surrey Heath are being covered by this because their GPs are using systems that are capable of being checked out for this system. So 56.3% is a good result for Surrey Heath, and it's presumably reasonably representative. Can we have the next slide? By contrast, this is Portsmouth, who seem to have a slightly higher coverage rate of coverage for flu jabs of 59%, but look at the coverage of how much of the people in Portsmouth are covered by the data collection. Unfortunately, Portsmouth is a place where most GPs seem to use System 1 practices, so we only have data about 2% of patients. So even though they appear to be doing quite well, you shouldn't take that as a good measure, because for Portsmouth, I'm afraid it's not. Now let's go on to the national data. Can we have the next slide, please? So, taking all of the data from the Learning Disability Health and Care data set, this gives you a picture of what's been happening over the last 3 years. You can see that the general picture is that immunisation coverage increases with age. Above age 65, when everybody's eligible for flu immunisation, it's about 80%, but it's lower at younger ages. The picture has hardly changed since 2014-15, and I think this probably means that most people with learning disabilities who are currently getting flu immunisations are getting them as a result of some other condition that makes them eligible anyway. The youngest age group here is probably an artefact, and if you want to ask me about why that appears to be higher, I'll explain why I think it is in questions. Can we go on to the next slide? This shows the variation between CCGs. So this is 2016-17 data, the coverage in the CCGs. The very top and the very bottom are probably artifacts because of being areas that have got very low amounts of data from them. But basically the best quarter of CCGs are achieving coverage in excess of 47%. That's not wonderful. And the weakest quarter of CCGs are not getting up to 39%. So you can follow the links that I put into the slide a couple of slides ago and see how your area is doing. And can I hand you over to Donna again?
Thanks, Giles, and I'm going to hand you straight over to Anna Marriott.
Thank you, Donna. As Giles had said, having reviewed the evidence, PHE's Joint Committee on Vaccination and Immunisation updated their guidance on eligibility for the flu immunisation and made specific reference to people with learning disabilities. So from the winter of 2014, people with learning disabilities were eligible for the immunisation free of charge. Giles talked about there being some confusion around this, so I put a couple of links into this slide about where you can get information. Just to clarify, the National Flu Immunisation Programme letter that's come out this year clearly states people aged from 6 months to less than 65 years with a serious medical condition, including, quote, chronic neurological disease such as Parkinson's disease or motor neurone disease or learning disability, are in a clinically high risk group, and they should therefore be offered immunisation without any further deliberation on eligibility. Obviously, this is notwithstanding clinical contraindications or individual choice. The Green Book also categorises people with learning disabilities as being in a clinical risk group who should receive the immunisation, but it has subtly different wording, saying clinicians should offer immunisation based on individual assessment to clinically vulnerable individuals, including those with cerebral palsy, learning disabilities, and it goes on to list other similar conditions. So the wording is only slightly different, and the main message from both these documents is that people with learning disabilities are entitled to a free flu vaccination, and therefore we recommend that GP surgeries make sure that people on their learning disability register should have this recorded in their notes. So they need to be categorised as needing a flu immunisation, and there is a specific read code for this. If we can move on to the next slide, please, Donna. Slide number 11. Reasonable adjustments are the modifications that should be made by services in terms of their approach or provision to ensure that disabled people can access the service in the same way as the general population. So it's about making changes that ensure fair access and treatment for people irrespective of their disability. Public sector organisations have a legal obligation to put reasonable adjustments in place to ensure equal access to healthcare services. And since 2016, all organisations that provide NHS or adult social care must now follow the Accessible Information Standard by law. The standard aims to make sure that people who have a disability, impairment or sensory loss are provided with information that they can easily read or understand with support, so they can communicate effectively with health and social care services. And where that's underlined, there's a link to more information about this. So reasonable adjustments can be implemented at a service level, such as sending out an easy read leaflet, but they could also be at an individual level in response to specific needs. And I'll give some examples as we move through. So moving on to slide number 12. Last year, we published guidance about supporting people with learning disabilities to have blood tests or injections. This guidance has tables in it with links to resources such as easy read information about having a blood test, videos, examples of apps, and support and suggestions on how to support people who are needle phobic. Just briefly, desensitisation would usually be the first approach. It is time consuming, but it can be very effective. We do know of examples where nurses work with entire classes or even schools of children to do en masse desensitisation work. So obviously making that more effective use of time. I've got a few other examples listed here that can help people with learning disabilities. So these include things like giving someone a longer appointment so the person doesn't feel rushed and has time to ask questions. Giving them an appointment at a good time of day for them, whether that's morning or end of the day. Using topical applications to numb their skin, so something like Emla cream. Putting a screen up so their arm goes through this so they can't see the needle going into their arm. Letting someone have headphones in and listen to music or watch a film or playing on a tablet or iPad. Distraction techniques can help someone cope with getting through something like an injection or a blood test. So in that guidance, there are case studies with more detailed information, and this does include examples where sedation and safe holding are used. This would be as a last resort and would require a best interest decision. But I suggest you go to that guidance if you'd like a bit more detailed information about supporting people. So moving on to slide number 13 now. When someone with learning disabilities who is anxious about needles requires a blood test or an injection, there should always be a consideration of any less invasive alternatives. So in relation to the flu immunisation, this would include the use of the nasal spray flu vaccine. The live intranasal influenza vaccine is given as a single spray squirted up each nostril. So this has got the advantage of being needle-free, and for children it's more effective than the injected flu vaccine. This isn't licensed for adults, as there's evidence it may be less effective than the inactivated vaccine. However, guidance for healthcare workers says that medical practitioners can choose to use the nasal spray off-label, and that this can be for, and I quote, patients with learning difficulties who become seriously distressed with needles. And there's a link in this slide to where that guidance is in that quote. PHE has agreed that the national stock of nasal spray flu can be used for this purpose, but it does need to be individually prescribed using a patient-specific direction, and there are links to more information here. We know that not having to have an injection may encourage some people with learning disabilities to get vaccinated, so this could be a very helpful reasonable adjustment. However, we are encouraging this to be viewed as a last resort, given that the nasal spray is not as effective as the injection in adults. So this approach should only really be used after other reasonable adjustments have been put in place to support someone, and that's still not been successful. That's when this would be a useful addition. Moving on to the next slide now. So it's clear that the best way to protect yourself from getting the flu is to have the flu vaccination. And if you have the flu injection, people around you are also less likely to get the flu. So this means that by getting vaccinated, people with learning disabilities are also helping to support their peers who may be more vulnerable than them, as well as others that they spend time with, possibly elderly relatives, for example. Family carers and paid supporters employed by a registered care organisation are also entitled to get a free flu vaccination from their own GP or a pharmacy. So this will help protect them, and it will reduce the risk of spreading flu to the people they support. NHS England has just recently published a letter to social care organisations confirming their staff are eligible to take part in the flu vaccination scheme, and there's a link to that in these slides. If someone wishes to have their flu vaccination at a pharmacy, then there's no need to take along proof of your status. You simply need to complete a basic form with your details and tick the relevant box, so the reason you're having the flu vaccination. So for example, this might say that you're a social care worker or a carer, or in the case of someone with learning disabilities, the category would be chronic neurological disease. So finally, moving on to my last slide, I just want to direct you to some of the resources we have that may be of use. We published a document last year with links to relevant guidance, policy and resources, and there's a link to this in this slide. But this has been updated, and we are hoping it will soon be available on a gov.uk webpage. We'll send the link round when it goes live, and we're hoping that will be in the next week or so. The next link on this slide is to easy read information that's directed at people with learning disabilities, their family carers and paid supporters. So that's just giving some very clear messages about their entitlement to free vaccinations and encouraging them to get that and the reasons for it. The third link on this is a PHE Easy Read leaflet telling people what flu is and how to get a flu vaccination. This link takes you to somewhere where you can download that leaflet, but it's also possible to place an order for printed copies. So if GP surgeries, for example, would find that useful to have some in stock, that's possible. I've included a link here to a short film from NHS England about someone with learning disabilities having their flu vaccination. This might be something that could be used to help prepare someone in advance of their visit. And the next link down addresses some of the issues around this being in someone's best interest and their capacity to consent. So if somebody has capacity, then they can obviously take the decision as to whether or not they want to have the flu vaccination. However, if they don't have the capacity for this decision, this shouldn't be a barrier to the flu injection being given. This obviously wouldn't be fair, and it would exclude some of the most vulnerable people. So then there would need to be a decision taken by the health professional that this is in their best interests. The document linked to here supports carers or relatives to make sure they take steps in advance to help the person with learning disabilities understand easy read information about the flu vaccination. It reminds people to think about any reasonable adjustments that may be needed and to contact the surgery to arrange these. There are prompts here to help supporters consider whether the flu vaccination is in someone's best interests, and this preparation work can help the medical professional who has to make the final decision on the day of the appointment. And the last link here is some easy read information about who is eligible for a free flu vaccination. This was created by Hertfordshire County Council's Learning Disability Health Liaison team, and it's specifically designed to be used in pharmacy, so giving clear messages about who is eligible under the free flu vaccination scheme. And I will now hand you back to Donna. Thank you.
Hi, Anna. Thanks very much. And thanks very much to John and Giles. So something that our team are focusing on with our NHS England colleagues this season is actions that can be taken to improve uptake of the flu immunisation for people with a learning disability. We've seen since the flu vaccination programme was extended to include them, we haven't really seen a big increase in the number of people with learning disabilities getting the vaccination, and it does seem that they're mainly getting it when they reach that older age, when the general population would get it. It seems that lack of knowledge that people with a learning disability should have the free flu vaccination is a barrier to increasing uptake, and we'd very much welcome your thoughts on how we can spread that message. There are things that we will be doing nationally with some of our national stakeholders to get the message out, and also try to get message into the hands of people with a learning disability and carers themselves, which is a far trickier group to get to. It seems to us as well that the inclusion of social care workers in this year's extended flu vaccination programme is a huge opportunity, but they are quite different to the NHS staff who've been entitled to the flu vaccination for some time, in that they're not all employed by the same organisation, i.e. the NHS. They're employed by lots of different social care providers, and there's a question about how we can make sure that the message that they can also get the free flu vaccination can get to them. So again, thoughts about how we can create an awareness with that group, given the potential there to protect the people that they're caring for, and that extends to people with learning disabilities and of course other vulnerable groups such as the elderly, who are often having care from social care providers in their own homes or in residential care homes. So there are national actions that we can take, and as a national team in Public Health England, we're thinking about those, trying to get the information through our networks as much as we can, as are our NHS England colleagues. But I know we've got lots of people on the line who are working in areas all around the country. So we would ask you to think about what actions can be taken locally to spread that message and see if we can achieve an increase in the uptake of people with a learning disability getting the flu vaccination. So in a moment, we're going to open for general questions online. So there'll be people who are dialed in as well as on Skype. But just before we finish, we have got a minute to spare, and we've had a couple of questions emailed in while we've been talking about the potential for the annual health check to link in to the flu vaccination programme, and whether we could use the health action plan to help achieve that, and whether we think that those annual health checks and health action plans are being linked up with specific actions like having the flu vaccination. So I don't know if John or Anna would like to comment on the potential we see there for the link with the annual health check.
Do you want to start, John, and I'll add in if I've got anything to say?
Okay, well, for me, this is, again, without repeating myself, is part of a holistic, considered package of care for people with a learning disability. So promotion of people being on the GP register. By being on the GP register, you've got good access to primary care, you get your annual health check, and you can be invited for your flu immunisation. And again, this can then feed through into a health action plan and reasonable adjustments and, you know, details of how you can be best supported should you need to access urgent care in an emergency, etc., etc. So it fits into a range of work that will support the person and keep them healthy. The important end point for all of this is that people's health vulnerabilities don't become a barrier to getting on with their lives. This is about keeping people well. Thank you.
Thanks, John. Anna, did you want to add anything to that?
I'd just echo it that I think that particularly until we are hoping that by the next season we might resolve the issue of people with learning disabilities not automatically being invited for flu vaccinations. So that requires some work at a sort of strategic level and looking at the way the systems are set up. But in the meantime, particularly, it is important to encourage GPs to code people as needing the flu immunisation, so those letters and prompts go out at the right time of year. And obviously the annual health check does seem the appropriate place to do that, irrespective of the time of year that's happening. And I guess that we're just working to do some promotion around this to encourage people with learning disabilities and their carers and supporters to really see the free flu vaccination as a right, rather than as something else nasty to kind of go through, but something that is there to protect them and that it's their right to have.
Thanks, Anna. And I'm just going to cover one more question very quickly before we end the main part of the webinar and move on to the more free flow Q&A. So someone has made a point about carers who are employed directly by the person being cared for or family, i.e. through direct payments, and this is an important point. So although the flu vaccination programme has been extended to include social care workers, the wording around that is that it's been extended to social care workers who are employed by a registered agency. So that would be a provider who is registered with the CQC. So there is a gap there around people who are directly employing assistants to support them through a direct payment. We have raised that with our flu colleagues in public health in NHS England. It has been acknowledged there is a gap there, and there's been quite a lot of thinking about how exactly they can word the eligibility. So I think at the moment it's a positive thing that social care workers who are employed by a registered care agency can get the flu immunisation, but we do acknowledge that there is a gap, and we welcome your feedback on that, on how you think that might be managed or defined in the future. So at that point, I'm going to end the main part of the webinar. There have been several links through the webinar to other places you can go for information. There are some links here as well, and in particular, again, the email account. So please do email us any questions now or after this webinar, or if you're watching it as a recording, we're always very happy to hear from you. If this is the first time you've joined us, then you can sign up for the whole series of our webinars. So you'll get a monthly invite, and we cover a different health topic relating to people with learning disabilities each week. So if you don't want to stay for the general question and answer session, thank you very much for joining us, and you can leave now. We'll just pause for a moment while I open up the line so that people can unmute themselves and ask a question. For those of you who already can, then go ahead and ask the presenters. Thank you.